Thank you all for coming. Recording is in progress, and so we're going to go ahead and get started. So we have an amazing speaker here today, my colleague, Dr. Ester Villalonga Olives, who is going to be talking to you a little bit about her work on developing measures of structural racism that actually could be applied to many of your work on population health. We also have some of her team members here, Alicia Crump, as well as Christopher Amisa. And there's going to be basically a part 2 to this series today, like a sub part 2, where some of the trainees, those who are PhD doctoral students, as well as master's students, can actually transfer to another room where they're going to be presenting some of the early work that they're actually conducting. So let me introduce you to Dr. Ester Villalonga Olives. She is a social epidemiologist with a PhD in biomedicine, specializing in epidemiology and public health. She obtained her bachelor's and master's in sociology and health from the University of Barcelona. Her PhD with international doctoral distinction was from Universitat Pompeu Fabra. Dr. Villalonga Olives is an associate professor currently and a tenured social epidemiologist with a PhD in, as I mentioned, biomedicine with specialties in epidemiology and public health. Her research interests are related to the study of social determinants of health, emphasizing social capital, health inequalities, structural racism, and a focus on the design of health interventions. She has a background in psychometrics, and I'm pretty sure you'll actually get a whole big glimpse up to in psychometrics related to structural racism. And has also worked in adapting and developing measurement instruments. Her work is also centered on implementing social capital interventions and investigating the relationship between social capital and health outcomes. She has used mixed methods, structural equation modeling, multi-level modeling, and item response theory methods as well in her work. She has published in many respectable journals, including American Journal of Epidemiology, Social Science and Medicine, and the Journal of Epidemiology and Community Health. So please join me in welcoming Dr. Villalonga Olives.
Thank you. This is wonderful. And thanks so much for such a good introduction and for pronouncing my name very well. Oh. Yes, as you can see, I'm Spanish. I'm from Spain. I speak Catalan and Spanish, and sometimes it's difficult to pronounce my name. I'm super happy to be here. And I came, as Adolfo said, with Alicia and Christopher. So we're going to share, I'm going to start presenting the background of our study. But since they are leading a good part of it, I asked them to come with me because I want you to see as well how this is teamwork, right? This is a big project that would never be possible without collaborators as Adolfo, who is part of this project, but also postdoctoral fellows like them, PhD students, and many other people that I'm going to be talking about in a moment, okay? So this is part of an NIH R01 funded work to develop a multidimensional and multi-level measure of structural racism. So let me start with some background. So I don't think I need to talk a lot about structural racism here. You all know what it is. So we use a lot the definition of structural racism from Dinzy Bailey, who is a consultant in our project as well, where she says that structural racism represents the totality of ways in which multiple systems and institutions interact to assess to assert racist policies, practices, and beliefs about people in a marginalized group. So we know that structural racism leads to disadvantages in the determination, distribution, and access of key economic, physical, and social resources. And the patterns and practices of structural racism we see a lot of discrimination and equity, for example, in healthcare settings, but also in many other settings. And this is important because it involves like having more disparities in health and in mortality outcomes. So part of our work is about thinking how we measure structural racism. There are very good measures out there, we know it. Some of the ones that we have been studying a little bit before proposing what we are proposing to do, or what we are working on now, are the ones that I added in this slide here. One is from Doherty et al. So it's Doherty and Lori Dean. Lori Dean is also part of our project. They developed an index, an ecological level index, to measure at the county level indicators of structural racism, such as housing, education, employment. And there is another measure developed by Chantara et al. From University of Minnesota that they use a different unit of analysis. And they also have indicators in this case that measure residential segregation, education, employment. Both of those indicators are more concentrated on Black populations. So they have been targeting Black populations. But Dyer et al. Published, I think it was last year, another very interesting index where they use census tracts as a unit of analysis, and they have other indicators. In this case, a larger list of indicators. And this one, it's kind of different because it's more, I would say, more universal. So they are not targeting Black people only, they are targeting, like, they don't talk about race at all. So it's something that we can be using. So I would think that depending on what you try to do, you could use one or another, for example. But when I was thinking about these measures, that are all great, I was also thinking about myself as a Hispanic community advocate. So I'm in the Washington, D.C., Baltimore area with a lot of Hispanic Latino people. I'm going to talk about Hispanics, thinking about Hispanic Latino people, okay, just to reduce, that suffer a lot of discrimination. And recently, it has been even worse with all these immigration issues and so on. So, and thinking about myself as a person who wants to be helping the Hispanic community, I thought, wow, so we know that by 2030, 21% of the US population will be Hispanic, right? So we need to know what happens to them. And we know that structural racism impacts health outcomes in this population. The problem is that I didn't find how to compare discrimination like structural racism across Blacks and Hispanic Latinos. So also, I was reading during the pandemic when we were all at home, and I was receiving the Harvard Gazette, and I was reading it. I found a very interesting interview to Dr. Krieger, Nancy Krieger, who was talking about that you can not understand the system of racial injustice without understanding how it ties to economic injustice. So, and when I went back to some measures of structural racism, I thought we are missing adding more indicators of economic injustice. So I thought, well, the work we could do should be expanding this and adding more indicators of economic injustice. So moreover, so we also conducted the literature research when we were thinking about submitting this grant to the NIH. So with a group of students, we reviewed 691 manuscripts. Probably this was 2 years ago because it's when we were preparing the submission. So probably now we would have even more. So we checked 3 different data sets and we collected information to understand what were the recommendations about how to measure structural racism, how to improve the way we measure structural racism. So there was a very interesting paper from Dr. Williams from Harvard University, who is also a consultant in our project, where he was talking about it's important to collect not only ecological level information, but also individual level information. So he was mentioning more like considering structural racism as a multi-level factor, and that new measures should be thinking about, like considering this multi-level perspective and also multidimensional. So there are other authors that talk about, for example, I think it's Paris Atkins Jackson, who talks about who talks about analysis of ecological and individual level aspects, and also incorporating qualitative data. So she's really talking about, okay, we are missing the voice of people who are really suffering structural racism. So when we measure this, we have to consider qualitative data as well. And it's Rachel Hardiman who has a very, very nice paper talking about incorporating community participation. So this is all the things that we got from the literature as recommendations to think about what we were planning to propose. So I went back. So with my psychometrics background, I think I teach a lot to I teach one course at University of Maryland where I do health outcomes, when I teach health outcomes assessment, and I always tell my students, we can never develop a measure, we can never develop a questionnaire, a patient-reported outcome without a very solid, strong theoretical background behind. Because this means that we are doing something wrong, right? And usually we need to develop this theoretical background with enough evidence that it's a good theoretical background. So I went back and thought, well, what kind of theoretical background we can use to develop this measure? So since I was submitting this to the NIMHD, I was kind of strategic, and I thought, oh, they have a multi-level, multidimensional framework that we could adapt as the framework to develop our measure. So we, as you see, there are some domains that have been adapted a little bit just to think about, okay, so let's think about developing a measure where we are going to be measuring all these different bins of the NIMHD framework. But of course, this is something that we were planning to review as well. This is what we were proposing, but this framework can be tweaked a little bit considering all the information we are getting from the community and so on, which I'm going to talk about this later. But think about this as the foundation of what we are doing. Another thing, so I have talked a lot about the ecological perspective, but for the individual perspective, we have psychometric tools to ensure that the information we get, it's valid and reliable for specific populations, right? So when I was digging into the literature, so we didn't find, for example, like instruments that were collecting discrimination data on using IRT methods, which is one of the tools I use, item response theory, and in combination with qualitative methods. And I believe this is a missed opportunity to not be able to use like tools that are already measuring individual level data, because if you use these methods, they allow you to identify well-performing, redundant, and poor-performing items. So you can select based on the quality of these items, which are the best ones. And it's very good for efficiency. And this is what I thought I had to propose to the NIH when working on this. So the objective of the individual level piece of the measure is to create like item banks, it's a collection of survey and questionnaire items, and think about differential item functioning. Why differential item functioning? Because we have two different populations here. So when we have individual level items, so if we want to compare discrimination issues, like in items that measure discrimination and racism, we want to compare Blacks and Hispanic populations, we need to make sure that there is differential item functioning in those items that are going to be for both populations. We know that we may have some items that may work for both populations, but we are really aware that there will probably be items that are going to be like specific for specific population. These are all the things we are considering right now. So just to give you like just a very like short overview of the team. So we have behavioral scientists and also psychometricians from several universities. We have Yusef Ransom from Yale, Wendy Camilo Castillo from University of Maryland, Celine Jones is in Seattle at the Fred Hutch Cancer Center, and Dr. Reeves is a very well-known a person who is doing psychometrics at Duke. And here I had a picture of Ichiro Kawachi, but it's not showing. It's white. Dr. Kawachi, it's not a ghost. He exists, and he's a social epidemiologist, a very well-known one from Harvard University. And this is the expert panel. You can see that Dr. Cuevas is part of our expert panel as a person who knows a lot about structural racism and discrimination, and also working with on the Hispanic community. We have Dr. Williams from Harvard. We have Dr. Taggart from George Washington University. Lori Dean is at Hopkins, and we have Zinzi Bailey, the person who wrote the Lancet paper and the New England Journal of Medicine paper on structural racism. He has been cited a lot, and she's a good asset as well for our project. And I think Zinzi now it's in the University of Minnesota. It's not in Miami anymore. But it's very good to have this team. And of course, I talked about community advisory board, and so we have community members as well, and we have other invited experts that are more experts in the economic side of structural racism. So this is the full team. So we are a quite big team, and also students. We have 3 PhD students involved, and also Alicia and Christopher who are here. So it's a pretty big team, because this project is large with a lot of things, and you will see why we need a pretty large team to be building this. So with what my colleagues are going to be presenting in a bit. And the good thing is that we are expanding the community advisory board. We thought we were falling short, and we need more voices there. So we are going to expand the community advisory board, adding 10 more people that are in the community who have suffered racism and discrimination, who can help us identifying like individual level items, or at least to be able to understand if we are missing things, if what we develop, it's meaningful to them. If we are missing, we have a framework, but without them giving us feedback on, okay, am I missing something? It's this what you are facing. So without their voice, it's impossible to do this well. So this is something we are working on right now. So just briefly, I'm the principal investigator, but as you saw, this is a very, it's a large team where we have sub-teams, because we have multiple things to do. And there is one content development team because it's more the conceptual part of it, where we think about the theoretical framework and how to develop all these, all the measure. We have the adaptation into Spanish team, which is a very important task, because we expect that the items that we are going to be identifying in the literature to build the item bank probably are going to be in English, but not everything is going to be in Spanish. So we need to adapt everything into Spanish. And cultural adaptation, it's not only a translation, it's a very long process. We have a qualitative methods team, and we have the data management and analysis team, and of course the academic experts and the community experts. So the overall goal of this project is to develop a new measure that comprehensively captures the structural racism that is valid for both Blacks and Hispanic Latinos. So before we go to the approach, let me tell you more about the measure characteristics for you to understand how it works. So based on all this background I gave you, think about this as a multi-level measure, where we are going to be combining ecological level data and individual level data. We are thinking about an intersectional approach because, of course, an intersectional approach acknowledges that everyone has unique experiences of discrimination, and these are shaped by wider overlapping systems of oppression. It should be multi-level. And other intersectional aspects, for example, the economic opportunity. So incorporating more indicators from the economic sector, we believe it's really key. And it is crucial that the measure is theoretically grounded. So I run into a lot of measures that look very good, but sometimes I miss observing why they ended up selecting those indicators. what happened, how they arrived to the conclusion that those indicators were more important than others. So, and for me, this is the first key step, and this is what we are going to be talking about today, basically. So theoretically grounded. So what is really what we need to measure, and adaptable for use in diverse racial settings. So we are thinking about Blacks and Hispanic Latinos now, but in the future, we are thinking about maybe we could expand this work for other groups. And of course, using a lot of qualitative methods. I believe there is never a good measure without a very strong qualitative component. So this is really a combination between qualitative and quantitative work. So the way we structure this, so I gave you an overview of the background. So now Alicia is going to tell you more about the approach. So we are developing the index. So I thought it would be very interesting that Alicia goes over like this qualitative piece where we have been selecting the indicators. You will see it's a very long process with multiple steps. And Adolfo's like, yes, because he's funny. So he's like, okay, they are bothering with emails all the time. So she's gonna talk about that part. And Christopher is gonna be talking more about the analytics that are going to be happening next. And after that, I'm going to tell you more what's happening after this first aim, which is going to be developing the item bank and finalizing this, combining the results of aim 1 and aim 2, which is ecological, it's aim 1, aim 2 is item bank together and check the validity. So we are going to concentrate on aim 1 basically, but of course we are going to tell you more about what's coming next for you to see how it works. And since Adolfo told us that he wanted us to talk about opportunities and challenges, at the end, we are going to talk about challenges, but we are going to end that with a positive message, okay? Please. Thank you.
Thank you, Esther. So as it was briefly mentioned, so aim 1 is going to focus on the ecological level indicators. So, and identifying what those essentially look like. So to formally announce what aim 1 is, it is to incorporate novel level data sources that comprise economic indicators to assess ecological level determinants of health disparities. Oh, the line. Okay, well.
Yeah, it's like the Giro goes, but I think that you are going to see that some slides are kind of.
Okay, well, just go with me here.
The PDF instead of a PowerPoint, probably it moved a little bit. But,
yeah. Okay. Well, to achieve aim 1, it was then essentially several different steps. So first was the pre-selection step. And this was when 68 ecological level indicators were pre-selected by the content development team. And these were determined based on previous literature or maybe even work kind of done in their own spaces. Those 68 ecological level indicators were then taken to a round 1 Delphi panel, which was an online off-site Delphi panel vote of indicator appropriateness for measuring structural racism. And those indicators were then categorized into 3 categories. So either to be retained, discussed at round 2 because there was some inconclusiveness, or if it was to vote to be discarded. And those cutoffs were 50%, if more than 50% said that it was important in measuring structural racism. If there was a general inconclusiveness, I think at least 43% said that it was not as important, or they maybe moderately important for measuring structural racism, it was to be discussed. And then if 50% or more said it was not important, then it was discarded. So from round 1, we had 27 indicators for inclusion, and then 16 for round 2 discussion, 25 discarded, and 25 newly suggested. We had a wide range of indicators that were suggested to be that were suggested to be in the index. Some ranging from like access to CDFI loans, other ones a little bit more nuanced in terms of maybe access to Black hair care products within a certain area. Those indicators were then taken to an in-person on-site Delphi panel discussion of indicator selection results. And this was, I think, it was one day, but it was like 8 hours, I think, of just very good dialogue about the importance of these indicators. And during this time, we really harped and discussed those 16 indicators that were set to be inconclusive. But to be completely honest with you, the conversation was open. We discussed indicators that were to be discarded, that were also recommended for inclusion. It was a very rich and informative discussion. So of those 16, 13 indicators from round 2 discussion were marked to be included, and then 3 were marked to be discarded. And we had an overwhelming 51 indicators that were newly proposed from that conversation. So that left us with a total of 86 indicators that were marked for final selection at the ecological level. So for the next few slides, I'm just kind of gonna go over some selected indicators as well as discarded indicators and some newly proposed indicators as well as their reasons, so that we can kind of get an idea of, I keep saying indicators, what exactly am I talking about? So for this slide particularly, we're looking at selected indicators and their reasons. High school graduation rates was overwhelmingly recommended to be retained at both round 1 and round 2, just for the rationale that it's this classic example of structural racism, and it's really related to the quality of education that individuals are receiving. Access to transportation. If I can't get to an opportunity, then I'm limited in the opportunities that I can therefore pursue. And that was really discussed in round 1 and round 2. Property values and tax base, with the rationale that this indicator is important and is based on historical discriminatory practices. So these are 3 of the discarded indicators as well as their reasons. Diaper insecurity, I think, was one of about 5 indicators that were discarded for the reason that expert panelists and community members thought that it was more related to social economic position rather than us measuring structural racism. Opportunity zones was another one, for the reason that historically these opportunity zones may not have served the incentive that they were actually created to do so. And then participation in extracurricular activities, that maybe these activities are more related to like social determinants, like income or something like that. Like maybe if I don't have the money, then therefore it makes it harder for me to be able to participate in these extracurricular activities. And also that this indicator may possibly be repetitive or redundant from something that we've already discussed in a previous measure. And then I put 6 indicators on this particular slide just to kind of show the wide range of newly suggested. Gentrification was a very popular indicator that was recommended in round 1 and round 2, and that also provided for a rich conversation during the on-site, just really for the rationale that it describes the deliberate turnover in Black neighborhoods. Ratio of predatory financial to legitimate institutions was another commonly proposed indicator, as well as consumer decisions on residential housing and school selection, hinting at that these things affect such things like opportunity and education, income, and growth. We also had a wide range of medical focused indicators, such as anti-Black bias from providers and medical mistrust, suggesting that these biases not only take place in healthcare settings, but also outside of healthcare settings. Okay, and then finally, those indicators that were from that 86, that large 86 number of indicators, they were then taken to an indicator rating step. And this was the final step in which all of those indicators were rated on an ordinal scale, from 1 being most relevant to 5 being not relevant at all, with the idea that maybe not all of these indicators function or should be weighted the same. Maybe economic level indicators, maybe they are stronger drivers of structural racism compared to more of the social interpersonal. 10 participants completed this rating activity, and it was composed, everyone completed it, expert panelists, community leaders, as well as the content development team. And it was a mean relevance taken for each indicator. So I know this image is very hard to see, but go with me here. Okay, do I have a pointer? No problem. Okay, so here, so if it's red, then that means that the indicator is important, but maybe not as important as measuring structural racism, but maybe not as relevant or shouldn't be weighted the same as the other ones. So in bin 1, these 2 indicators, I know they're small to see, but this one right here is marriage and family constructs at the top, And then the other dark red one is percent of working adults with FMLA. Those two indicators are red, indicating that they're not as strong in terms of measuring structural racism. However, bins 5, 6, and 7, those bins tend to have more economic related indicators. So maybe these are more important or should be weighted, not more important, but should be weighted differently compared to other indicators. And with that, I'll pass it off to Chris. Oh, okay.
Are there any questions? Because I didn't say that you can interrupt. So
I had a
sometimes
quick
it's good
question.
to
I was
have-
wondering, who were in the panel of Delphi, the Delphi panelists, who were there?
The Delphi panel was the I'm sorry.
No, you can.
Oh, okay. The Delphi panel were the expert team that we saw a little bit earlier. So that's also Dr.
Oh, I see.
Williams.
Mhm.
So the content
As well.
development team, sorry, because I think we skipped, was a slide that didn't show, which was the methods before showing you the results. I realized that the slide wasn't there. So it's important to say that the content development team started with a list of 68 indicators. And we circulated offline, we asked people to, like the experts of the team, since the content development team had developed that, we asked the expert panel, which is composed by the community members and the academics and other invited experts, to start telling us what they thought about that, and they had to vote. So it was a vote, anonymous vote. So we collected that information, and with that information, we were able to run a Delphi panel on site, where with previous information, we had materials to share to say, okay, all these were endorsed, so we didn't even have to discuss because a lot of people said, yes, these are important. There were some that were very clear that they had to be discarded, and there were some that they were kind of in the middle. And this is where we had these conversations. So we went bin by bin as part of the theoretical framework I showed you. We were bin by bin saying, okay, let's review these indicators that are part of this bin. So we have not concluded, so we didn't arrive to any conclusion because we were endorsed by 40% of the panel, which we thought was kind of too low. Let's discuss that. And here is where the discussions were pretty important. That's why we spent 8 hours and we didn't finish. So the people in the room were very interested. It was a very good day. And also like students joined and many people joined just to observe these kind of conversations, which is, I think it's a good learning exercise about how to come out with an idea. And it took months to analyze that data. So 8 hours of information. It took months to end it up with a final list of the 84. And when working on this, we realized that when you analyze the data, I have never seen an index. Maybe I'm wrong, but I don't recall observing an index that has weights. But I remember talking about in the content, when we had meetings with the content development team, we were like, based on the conversations we had, some things are very strong. They are very important. We can never think that everything weights the same. So this is what we need to propose. So this was the third pane of the process, was to start what Alicia showed you, because of course you have to say, okay, this is the final list, let's start. And also with the newly proposed indicators, that was another process where the content development team had to make some selections. So we had a voting process, but the content development team was the final. So we are 4 people that made the final decisions. So it's a very long, like many months process of first round, second round, reconciliation, waiting, and we are now almost done. So, Chris, please. But questions, yes, please, sorry.
Yeah, just a question. The 8-hour session, did you like transcribe and code the whole thing? Yeah.
It was, we had PhD students very interested in coming and also in rotating with us, having some project experience, people that were in the first year that wanted to have some experience doing this kind of work. My department is very quantitative, and I'm quantitative as well, but I'm trying to spread the message of I cannot run anything quantitative later without having all these strong qualitative rounds, right? So it was a good learning exercise, and they discovered how difficult it is to analyze this data. So we ended up with documents that are like with a lot of information. And also with many, Dr. Williams kept talking about papers we had to read. He was like, oh, think about this. So with this indicator, there is this paper, and each year is like a library as well. They were talking about papers. So we ended up with all this, but also a list of papers that we wanted to read. And we have had some journal clubs after that, basically reading what they suggested us to read. Any more questions before we continue? Okay.
All right, thank you. So I think we can appreciate the work of the Delphi panel, bringing up all these indicators, 8 hours for work, discussing all these indicators. So that begins, so in creating the index, we followed some steps. So the first step was the selection of the index, and that involved the work of the Delphi panel. After their work, the current stage is pulling data to assess or measure all those indicators, so over 86 indicators. So we are trying to get data set from, existing data set to capture all these indicators. That's a tough job. So that's the current stage. So when we are done with that, we move to statistical modeling, when we model the data set to create the index. And that will be followed with validating the index using relevant health-related measures. So after the validation, I think we'll make the index publicly available for research purposes and also for policies. So to give you an overview of the data that we are dealing with. So we are basically focusing on big data, basically existing data from relevant sources, those that will capture the indicators. And then we have some criteria for selecting the data. One, we need county or zip code level data, the least geographic level data as possible. And then we also expecting to have comprehensive coverage. So we are expecting to at least cover 80% of the country, or at least 40 states plus the District of Columbia. So that's the criteria for selecting the data. There are several of these data sets. As you could imagine, about 86 indicators would require several data sets. But just to point out some examples of these data sets, we have the American Community Survey, the ACS. That is our primary source of data. So as much as possible, we are selecting most of our variables from this data set to be consistent and also to reduce the possibility of, the level of measurement error. If you're able to capture all these indicators from one data set, it will be the best. But given the variations in the data, the variables or the indicators, we cannot have all of them from one data set. So we are also exploring other data set, including the annual business survey, which also provides information about businesses, the Black-owned businesses, the characteristics of the business owners and their performance. We're also looking at the uniform appraisal data set, which also gives us the appraisal value of homes. So when we have Black populated areas, how do they appraise the properties compared to white populated areas? So these are some of the data set that we are using to capture the indicators. So in pulling the data, we also followed some systematic process. 5 steps were followed. So first was the intensive search of data. And then second was to evaluate the data set to determine the appropriateness for capturing the indicator. So that also involved reading the code books, publication manuals, or user guides. There are a lot of things to do over there. And then when we determined that variables were relevant from the data set, we selected those. And then we capture the data set, we store them in a shared folder for easy access to the team members, and also for the next step, which is statistical modeling. And then the final step was to cross-validate the data, the individual work. So we are working in teams, so individuals are working separately. So we have to cross-validate and make sure that we are all conforming to the guidelines, and then we are meeting the set criteria. So these were the 5 steps that we followed in selecting data to capture the indicators. So doing this, we definitely would have some challenges. So we have a few of them outlined here to share with you. So one major challenge is the limitation with geographic level data. So our focus is to look for zip code and county level data. But we see most data sets that are very relevant for our purpose, but they are not reported at zip code or county level. So that is a limitation that we have been dealing with. And also the reporting frequency. So we have variations in how data sets are reported. Some are reporting annually, some are reporting biannually. So these inconsistencies also affecting our work. So as much as possible, we need to be consistent. And then that means you have to dig further to find alternatives that would help us build a robust index. And then also data adaptability is another challenge. So these data sets were not created for our use in building structural racism. They were created for different purposes. Our goal is to adapt them to suit our purpose. So we are limited with how much we can do with a data set. And then also limited access to data is another challenge. So some data set, you see them very good, but you don't have much information unless you pay to have access to. Sometimes they restrict access based on confidentiality or privacy purposes for the participant. So that slow our process down, because then you have to reach out to whoever hosts this data set. But we need to make initial determination as to whether they are relevant before we can even reach out to the owners of the data set. And then one last disadvantage or challenge with pulling the data is inadequate description of the data. So related to the previous one, if you don't have enough information, it's very difficult making sound judgment as to whether this data set will be relevant or not. So these are some of the challenges we face in pulling the data. And also we foresee some challenges when we get to the next step, that's a statistical analysis or modeling in creating the index itself. So we have different source of data, different approaches these data sets were collected with different approaches. So one big challenge that we foresee is how to integrate all these data sets, especially some are on different scales or on different approaches, how to integrate them to build the indexes. So one challenge that we are trying to work around. And also data missingness. We are targeting the lowest possible geographic level information. And most data sets do not want to report that kind of information for privacy or confidentiality purposes. So that that would create some gaps in terms of the availability of the information. So for example, the ACS has limitation with the 1 year estimate. For that reason, we are going as far as 5-year estimate to overcome the issue of data missingness. And then we also see methodological differences that could also affect the different levels of accuracy of different data sets. So we also have to cater for that in our next step. And then data quality and measurement variability is another issue that we would have to address moving forward when we get to the the next step.
Okay, my turn. And I want to be, and checking the time because I don't want to spend too much time on this, because I want to make sure that we have time for questions. So this is an overview of what we are doing in aim 1, which is the ecological level index. But aim 2 is totally different. And we started already because they are quite independent of each other. And this one is going to be very long as well. So this is to create the item bank from existing discrimination measures and items of economic discrimination practices with measurement invariance across Blacks and Hispanics. So I just wanted to summarize the research design just for you to be aware of how complex this can be. So an item bank, so you can talk more about what's an item bank, but basically it's a composition of items that have been used already. And we need to identify these items from racial discrimination measures. This means that we are now in the process of collecting a lot of information in the literature about questionnaires that already exist. Because we don't want to create new items if we already have some items that have been used and they have good quality. But we have to assess the good quality as well. So this is a process. And it's very important that after identifying this, which is something that Alicia is going to lead, and we started, and we will have tons of questionnaires to review, and and we need to collect a lot of information from that, because of course you need to ask permission to use those items. So it's a very quite complex process, but it's very important to evaluate the item pool with an expert review. It's when, again, the experts are going to be playing a role here. So we will have to compare and probably map out what we identify in the literature with the NIMHD framework and see if we have items that are covering like the full spectrum of the NIMHD framework. And after this, it's when the item review process begins. So when we are sure that we are having the items we need, so we will have to check, well, the data management team and we are gonna run the 2 Delphi panels again to vote and see what's more relevant and what's maybe less relevant. But I anticipate, I have worked on this space for quite a long time, we will not have enough items in the literature. So I expect to have to create new items. This is where the qualitative process begins again. And we will have to translate items into Spanish, so we have a framework to do that. So this is gonna be another part. And after this, it's when the cognitive review interviewing plays a role. And again, after this, you have to run another expert round of reviews based on the results you get. And after this is when you create an item bank. So I expect this to be a 1.5 year process for sure, if not longer. And after that, it's when you have to start data collection and when you can actually have data to perform a data quality review. And it's when you discard some items, it's when you start this is a very short overview. I'll be happy to come back when I have results from this to show you what happened and to show you the process with all the results and so on. And after that, think about the ecological level and the item bank as something that we want to combine. So the last part of the process is to calculate the multi-level scores. So you can have for one person an ecological level score, but also an individual level score of the perceptions of racism and discrimination, but end up with a final score. So we envision this as 3 different things. So if a person is more interested in the individual level score, okay, let's use only the individual level score. If you want to use the ecological level one, that's fine, but you can combine both, which I think it's the beauty and the novelty of what we are doing. I think I'm gonna skip the technical aspects, but the last step, it's more like testing the validity and reliability of the measure, which is the final part. With a diverse sample of Blacks and Hispanic Latinos. And basically what we want to do, it's when we have it ready, we want to see how our measure predicts stress and quality of life, among many other things. This is a simplified version of what we want to do. And we will have to collect data again within another sample. So the idea is to collect data on 1,500 people in total, and we will calculate the multi-level scores, and we will evaluate the reliability and the validity of this. So, and what I didn't say in the previous, so when I was talking about the individual level items, think about this. So we are thinking about individual level items that could be used in both groups. But we know very well that there will be something that we will discover in the quantitative interview that are going to be very meaningful for one group and probably not for another group. And we know that the Hispanic population, it's not a monolith, so there are many differences. So we may have to have specific items that are for specific groups. So we consider that as well. But for the simplification of this, I didn't explain that, but just think about that this is quite complex. So this is only what I wanted to say. So we expect to have a theory-driven, culturally and racially relevant and psychometrically sound measure of structural racism that could be used in policy, clinical, and research settings, and hopefully to find effective interventions to reduce health inequalities and to finalize with a positive message. So I asked Judge Chris to summarize a couple of things and also to talk to you about opportunities they have had as being part of this work, since we have trainees here. So I always like finalizing with a positive message, as I told you.
I think I'll be quick here because of time. So all said and done, when we have our measure, we believe that it will help create educational awareness about and then stimulate the public discourse on the effect of structural racism on various people and communities. And also it will help provide geographical understanding of existing inequities in our community. So our goal is to map these, the data on the US map, capture it at the geographical level, county level. So that when you click on the map, you'll be able to assess, hey, for this county, is the level of structural racism that exists or the level of inequity that exists within that location. and then also to inform policy. So policymakers can use our data to determine which areas would need resource allocation, and then also for research. And then finally, to monitor the effectiveness of intervention. So when we institute interventions to reduce structural racism, we believe that to be able to assess or monitor the progress or the effectiveness of the intervention, our measure will be able to help achieve that goal. So those were the policy benefits. What about research benefits? So for people who are interested in health disparity research, we believe that our measurement tool can be used to investigate how structural racism affects health disparity outcomes. And then also, if we're interested in intersectional analysis of structural racism and other sources of discrimination like gender, race, and gender, class, and disability, our measure can be helpful for you. And if you're also interested in longitudinal studies to track changes over time about structural racism and the progress counties are making, I think our measure can also be of good purpose. And then for geospatial studies, since we aim at plotting our data on the map to be able to understand how structural racism plays out across the United States at county level, we believe that it can help inform zoning laws, redlining policies, and also to create access for resources, create access to resources for communities that are deprived of resources. And also it would stimulate interdisciplinary research among social scientists, educators, and then people in public health, as well as community leaders who are interested in fighting the ills of structural racism. So these are research opportunities that we believe individuals can, buy into when we are done with our structural racism measure. Also, on personal level, I think it's been very great working on this project. So we've had an opportunity to be mentored by experts on this grant, multidisciplinary experts like Dr. Villalonga and many others. And also the opportunity to write NIH grant. So Alicia submitted, one supplemental grant from the NIH, and I also just submitted one. So it's great working on this project.
And you got it.
Yes. And also it's helping us both improve upon our collaborative skills, working together as postdocs and with other doctoral students and also with the larger team. And then finally, it's also enhancing our skills in research, of course, also taking up leadership role on various projects. And finally, increasing our scholarly productivity in terms of producing papers for publication and then also presenting our work at conferences. Thank you so much for listening.
So we were almost on time, right?
3 more minutes left, so I think we may have time for possibly one question, but if you have time afterwards,
Of course,
if
we will
people
be
have questions.
Available,
Yeah,
for sure.
then you can feel free to ask questions.
Happy to. Yes, please.
Hi, thank you so much for the talk. So I was just curious, particularly for your AIM-3, where you're studying doing the measurement and variance for the Black and Hispanic populations. So if you have participants who identify as Black and Hispanic, how do you handle
Oh, yeah,
those?
I was reviewing recent data on how many people responded one specific survey to say if I had the sample to anticipate if this happens. So I think about 2% of people of that sample responded as being Black and Hispanic. So, and this is something we need to discuss with the content development team for sure. So it's what I say. So we cannot think about these groups as being totally independent and also as part, we also think a lot about Hispanic populations being different because they come from different locations in Latin America, or they live in several areas that are quite different here. But also, I think Black populations are different as well. So this is where the qualitative work and the content development team have to really think about possibilities. So I think it's an opportunity to observe commonalities, which is what we are going to be targeting, things that are going to be applied to all groups. But it's an opportunity to also observe what are the differences. And it's when we have to think about probably specific modules that are going to be for specific populations. We may not be able to do all this in one project, and we may need to submit more diversity supplements, more RO ones in the future. But we anticipate having all these challenges for sure.
Please join me in thanking Dr. Villalonga, Dr. Amisa, and Dr. Crump on this wonderful presentation. There's going to be a follow-up to this as well for trainees. So please join me in thanking them for this wonderful presentation.
Thanks so much for the invitation. It was great fun here.